Hey guys, Dr. Segel, UroCoach. So in this video, I want to talk about something that can affect the way that guys pee that are in their 20s, 30s, and 40s that oftentimes gets overlooked. Stay tuned. Hey guys, Dr. Segel, UroCoach. So in this video, I want to talk about something that can affect the way that young men pee, but oftentimes people don't realize what it is. But please first like, subscribe, comment. We want to hear what you guys want to hear us talk about. So we see a ton of guys that are young, 20s, 30s, 40s, that say, Doc, I'm having problems getting urine out. I feel like I'm not emptying my bladder. I feel hesitancy of urination, etc. And they've seen other doctors and they've been diagnosed with prostatitis, which is inflammation of the prostate, or they've been told that, you know what, it just has to do with your diet. It's the things that you eat that are affecting the way that you pee. And oftentimes that's the case. Those entities do exist and they do cause the symptoms that I just mentioned. But there is something that oftentimes gets overlooked, and that's called primary bladder neck obstruction. Now, what is primary bladder neck obstruction? So your bladder sits above your prostate. In order for urine to get out, your bladder has to push urine past the neck of your bladder through the prostate and then to the outside world. Primary bladder neck obstruction is when at the level between the bladder and the beginning of the urethra, even before the prostate, that sphincter, that internal smooth sphincter, does not relax, okay? And that's called primary bladder neck obstruction. Now, the symptoms associated with the primary bladder neck obstruction can be very similar to what individuals have read about for an enlarged prostate, but oftentimes primary bladder neck obstruction is seen in younger individuals because they don't have an enlarged prostate yet they may have these urinating issues. So specifically, they feel like they can't get urine out, they're trying to push to get urine out, they feel hesitancy of urination. And what happens is that the bladder is trying to push urine past the bladder neck, but that's where this smooth muscle resides that involuntarily contracts when it should relax. And when it contracts, instead of relaxing, urine gets stuck there and the individual really has to push urine out. So the next tricky thing with primary bladder neck obstruction is how do you diagnose it, right? So the way that you diagnose it is a test called urodynamics. That's a test that's oftentimes done in a urology office where they measure the pressure at which somebody urinates. But beyond just a typical urodynamics, what has to be done is a video urodynamics. So beyond just figuring out the pressure at which somebody urinates, pictures have to be taken with x-ray to see what the junction between the bladder and the urethra looks like, the bladder neck. Does it stay really tight when the individual tries to pee? If so, then primary bladder neck obstruction may be the diagnosis. Okay, so let's say you've been diagnosed with primary bladder neck obstruction. What is the treatment for it? So the treatment oftentimes is a medication that you've heard about, alpha blockers like tamsulosin, Flomax, etc. You've probably seen them on TV. And individuals think about these medications as working on the prostate, which they do, but remember, there's smooth muscle at the junction between the bladder and the urethra. And when that smooth muscle is relaxed by tamsulosin or medications like it, then you can pee better. So sometimes individuals will get this medication, they'll say, man, I'm peeing better, it must have been my enlarged prostate, but in reality, it has to do with their primary bladder neck obstruction that's getting relaxed and their symptoms get better. On occasion, not frequently, on occasion, if medications don't work for that individual, if alpha blockers don't work for them, then we have to consider a procedure to open up the neck of the bladder by making a little incision to relax it enough so that people can pee. Now that's uncommon, but it exists. The last point I want to make is differentiating pelvic floor tightening from primary bladder neck obstruction. Okay, primary bladder neck obstruction means that the junction between the bladder and the urethra is tight because of an involuntary muscle, okay? Pelvic floor tightening means that you have this voluntary tightening or stress in your pelvic musculature, and it makes it so that your bladder cannot push past this tension, and you feel a lot of the symptoms that are described with primary bladder neck obstruction or an enlarged prostate. Now, the treatment for if you have pelvic floor tightening oftentimes involves pelvic floor physical therapy, where you go to a physical therapist and they teach you ways to relax your pelvic floor so that you can empty your bladder more effectively and you don't experience the symptoms that I just said. Now, if you go to a pelvic floor physical therapist because the doctor thinks that this is the problem, pelvic floor tightening, and you actually have primary bladder neck obstruction, it's not going to help you, right? Because primary bladder neck obstruction is an involuntary muscle, and pelvic floor physical therapy focuses on relaxing voluntary muscles. So keep that in mind if you go to pelvic floor physical therapy and it's not helping you. Anyway, guys, I hope that's helpful to you in identifying something that oftentimes gets overlooked that can affect the way that guys urinate in their 20s, 30s, and 40s, and really even in older ages, but oftentimes in that age group that I just said. Thank you so much for listening. We certainly appreciate it. Please like, subscribe, comment. Thanks.